Hello, my name is Bridget Donaldson, and I'm a Sanford University nurse practitioner student, and I'm going to be placing 6 simple interrupted sutures to a forearm laceration. The indication for this type of procedure would be to close a deep wound and also to prevent microbial agents from invading the wound and causing an infection, and also to promote the healing of the wound as well. Okay, I will be using a 4-0 suture, and due to the area or the where the wound is located, there's some tension in that area, so the 4-0 suture can support it can support and maintain the closure of the wound during the healing process. In a clinical setting, this type of procedure would be done under sterile technique. Today, my setup includes my scissors, my needle driver, my tissue forceps, and also my 4-0 suture. Wound preparation begins obviously with hemostasis. If necessary, the wound can be cleaned with an antiseptic agent around the wound, and lidocaine 1% would be used as a local anesthetic injection to the wound. No epinephrine is necessary in this situation because there's no bleeding, and there's no need to prolong the effects of the anesthetic. Prior to injecting the lidocaine, the patient just needs to be informed that there might be some stinging or some burning once it's injected, and it'll take about 2 to 5 minutes for it to take effect, and it can wear off anywhere between 30 minutes to 2 hours. And lidocaine does have some side effects, so the patient also needs to know that it can cause some skin irritation and also an allergic reaction. So if they know a rash or swelling in that area, they need to notify me even after the procedure is done. It can also be accidentally injected into a vein. So if that occurs, it can lower your heart rate. It can lower the heart rate. So patient just needs to know to inform me that if they experience dizziness, lightheadedness, if they feel like they're going to pass out, if they feel like their tongue or their lips are swelling or their throat starting to close, they just need to notify me immediately prior to proceeding with the procedure. Okay, once, and obviously that area is going to be completely numb, and there'll be a complete loss of sensation. So any driving or operating heavy machinery post-procedure is not, your patient's instruction not to do that. Okay, so once the anesthetic has been injected, the wound can then be irrigated with some normal saline, and that's just to remove any bacteria that might be on the surface. The patient also needs to be assessed for the need for tetanus vaccination or immunization, and so if they have a history of having 3 doses or more, or that last dose has been given within the past, and that last dose has been given within the past 5 years, then tetanus would not be indicated in this situation. And prophylactic post-procedure prophylactic antibiotics would also not be indicated unless the patient has a history of being immunocompromised in any kind of way. If they have a history of diabetes, heart disease, chronic steroid usage, if this was due to a dog bite or a human bite, or if the wound was excessively dirty, then they would be indicated, but in this situation they are not. Okay, Now it is time to proceed with the procedure. So I'm going to open my 4O suture. Oh, and also with antibiotics, there will be a thin layer of topical antibiotic placed on top of the wound post-procedure. And the patient just needs to know to leave that in place for 24 to 48 hours. But if in fact they do take a shower and that washes off, then they can reapply it, but just discontinue it after 48 hours. Okay. Yeah. Sorry. Okay. Surgeon's knot. 1, 2, 3, and 4. Surgeon's knot. 4. Surgeon's knot. 1, 2, 3, 4. surgeon's knot. 2. I'm sorry. 1. 1. 2. 3. 4. Surgeon's knot. 1. 2. 3. And 4. And now for my 6th and final suture. Okay. Surgeon's knot. 1, 2, 3, and 4. Okay, and I'm just going to hold that up so that you can see the sutures. Okay, now education. So the patient just needs to be educated that they'll need pain medication post-procedure, because once that lidocaine wears off, they're going to be in pain. NSAIDs over the counter is recommended because that will help with the swelling, and it will reduce the pain. So that's like a Aleve or ibuprofen. They can take it according to the manufacturer's recommendations. And if they notice any reflux or stomach pain, then they just need to notify me so that I can prescribe something different for their pain. They can shower about 8 hours after the procedure, but just gently clean the wound with some soap and some water. And when you get out of the shower, just pat it dry. No tub baths, no swimming. If you notice any crusting throughout the day, just wet a Q-tip and just kind of go around those dry crusting areas and remove that. Return to the office in between 7 to 20 days to follow up, have your sutures removed. And obviously, you need to monitor for signs and symptoms of infection. So if there is any infection, you might see some increased redness, some skin, increased pain, and you might even see some purulent drainage. Just notify me immediately if that occurs. And in that case, you may need some antibiotics. And again, follow up 7 to 10 days to have the sutures removed. And there can be some complications with suture removal. Obviously, infection is always still a possibility, so continue to monitor for those same signs and symptoms of infection. And scarring can also occur, so you're more than welcome to use scarring cream after about 2 weeks post-procedure. And then wound dehiscence is also a possibility. That's where the wound reopens. And so if that occurs, just notify me immediately. Thank you.